Tulare County is on the brink of a mental health revolution, with a groundbreaking new facility set to transform how residents access critical care. But here's where it gets even more compelling. This isn't just about a building. It's about redefining support systems for those battling severe mental illness and substance use disorders. Let's dive into what this means for the community and why the details matter more than you might think. The county has recently secured a major funding boost to expand its plans for a mental health and substance abuse center in Visalia. Located at 347 East Walnut Ave, the site was once home to Casa Grande senior care homes. This strategic move aims to keep patients closer to their support networks, instead of shipping them out of county, a decision that officials say could dramatically improve recovery outcomes. Dr. Cassie Emis, Deputy Director for Behavioral Health Services, calls the facility groundbreaking, especially because it will comply with the Lanterman-Petris-Short Act, LPS, a law that safeguards the rights of individuals in mental health care. This is a locked residential facility that can treat patients according to the latest legal standards, she explains. And that's something we've desperately needed. The project's momentum comes from a $9.9 million infusion through California's Behavioral Health Continuum Infrastructure Program, BHCI. Second, a mental health rehabilitation center and substance use disorder residential treatment facility will combine two buildings, 60 beds for mental health rehab and 16 for more intensive residential care. But here's where it gets controversial. The facility may also serve individuals under Proposition 36, which allows nonviolent drug offenders to opt for rehabilitation over incarceration. However, no dedicated funding exists for this purpose, raising questions about how the county will balance these responsibilities. We're not here to treat all Prop 36 cases, Ennis clarifies. It depends on the individual's needs and the severity of their condition. This pragmatic approach highlights a broader debate. Should public mental health resources prioritize those in crisis, regardless of their legal status? We'd love to hear your thoughts in the comments. The facility is slated to open in November 2027, though timelines may shift during construction. Tulare County Health Human Services Director Donna Ortiz emphasizes the urgency. We had a shovel-ready project because we already owned the Casa Grande property. This funding fills in the gaps to make it a reality. Meanwhile, the county is finalizing a name for the center, which will honor a local behavioral health advocate, a fitting tribute to the people who fought for these changes. So what does this mean for Tulare County's future? A more connected, compassionate approach to mental health care. But will the funding challenges and legal complexities derail progress? Share your perspective below. We're all in this together.